All right, it's 4 o'clock, so we'll get started. Good afternoon, everyone, at least afternoon for those of us on the East Coast in the US. Thanks for joining us. We're here to talk about the Master of Healthcare Innovation, or the MHCI, which is an online degree program here at the University of Pennsylvania. The MHCI is actually the university's first fully online degree program. It was carefully designed for effective online education, and the program has actually been a thought leader for others, especially other educational programs right now who are having to figure out how to quickly adapt to remote learning. First, a few housekeeping things. We're expecting quite a number of people on the call, so we're going to keep everybody muted, but if you have a question, you can type it into the chat box, and either I or another staff member will see it, and we'll read it aloud and answer it for you. There will be dedicated time for Q&A at the end, but if you have a burning question that you want to ask while we're on a particular topic, you can feel free to type it into the chat box. I've put up my email address in the chat box in case you want to contact me outside of the session. And we're also recording the session, and we'll send out a recording to everybody later this week. So I'm Catherine Rodella. I'm your presenter today. I'm also the program manager for the Master of Healthcare Innovation. So I work on the administrative side of the program. A lot of my job involves student support, and I'm kind of the first point of contact for prospective students and current students in the program. Also joined today by Adam Zolkover. Adam, would you like to introduce yourself?
Sure. My name is Adam Zolkover. I'm the Associate Director for Online Instructional Design. What that means is that I help faculty get their courses online and in a state where they are most effective for students who are coming into the program.
Awesome, thanks, Adam. So here's a quick look at what we're going to be talking about today. We'll go through an overview of the program, including goals of the program and what the student body is like, talk a bit about the on-campus session, we'll review the curriculum. We'll hear from a couple of current students who are on the call about their experience in the program so far. We'll talk about what the online learning experience is like, tuition, and finally we'll cover a couple of certificate options before we move on to the admissions process and then Q&A at the end. So again, if you do have a question you'd like to ask before the Q&A, you can go ahead and type it into the chat as we go along and we'll answer that for you. So the MHCI, like I mentioned, is an online master's degree program bestowed by the University of Pennsylvania. It's designed to help you improve healthcare and to adapt to the rapidly changing healthcare landscape. It's housed in the Department of Medical Ethics and Health Policy here at the University of Pennsylvania, specifically in the Perelman School of Medicine. And again, it's designed to help you improve care and adapt to change. And these are skills that today's healthcare professionals need to know how to do, whether they're clinicians or non-clinicians, managers, executive consultants, researchers, all need to learn how to improve healthcare. So the degree will help you answer different kinds of questions like, how can you shape policy, or how can you influence patient and provider behavior? How do you identify inefficiency and how to test solutions through rapid iteration? So these are all topics that the MHCI covers that typically are not covered in, say, medical school or business school or nursing school. And that's what sets the MHCI apart. And one of the most important aspects of the program is networking. The MHCI is meant to connect you both to faculty experts and to your fellow students who are healthcare professionals in all different sectors of the healthcare system. The MHCI is a pretty interdisciplinary degree. Many of our faculty come from the Department of Medical Ethics and Health Policy in the School of Medicine, where the degree is housed. We also have faculty from the Wharton Business School, from Penn Law, and from the Penn Medicine Center for Healthcare Innovation. And the program covers 4 primary fields. Those are health policy, behavioral economics, so how to influence behavior change among, say, your patients or stakeholders, operations management, and finally, innovation methodologies. So things like, how do you pilot an innovative project or program? How do you evaluate it? Some very practical skill sets for implementing innovation in a healthcare space. And what's unique about the MHCI is that it focuses on skills in two main areas, and those are innovation skills and leadership skills. All of the coursework is meant to drive you towards practicing these skills. So this combination is what sets the MHCI apart from, say, an MBA or an MHA. Those programs will focus on different types of skill sets, but the MHCI specifically combines focusing on innovation and leadership. And when we send you the recording of this session later this week, we'll also include a document that goes into these specific skills and learning competencies of the program in a more detailed way to help you see what you can expect to learn in the degree. And you can also use that document to help you pitch the program to, say, a supervisor or anyone else you might need to get support from in order to pursue the program. So you can kind of point to the document and the competencies and say, this is what I'll be able to do if I get an MHCI. So how do these competencies play out? What do students actually do in the program? First, you'll build a network of healthcare professionals and resources. This is a cohort-based program. Our students are healthcare professionals from a really wide variety of sectors and roles in healthcare, and they learn a lot from each other. They're both clinicians and non-clinicians, and there's a lot of relationship building in this program. You'll develop skill sets for solving systemic solutions to problems in healthcare. This is not a research degree. Rather, it's meant to provide you with very practical skill sets and tools that you can use immediately to improve the way you're doing your current job or to improve the way that you approach future roles. And we've heard from students, especially right now, that they've had lots of opportunities to apply these skills as they're facing constant changes in work every day from the COVID-19 epidemic. And finally, you'll get a chance to apply these skills and these concepts in practice-based innovation labs so that by the time you're done with the degree, you'll be able to implement an innovation project in the real world. Any questions from anybody so far? Okay, great. So I want to talk a bit about the student body. What kinds of healthcare professionals pursue this degree and who enrolls in the degree? MHCI students are all mid-career healthcare professionals, and like I mentioned before, they come from many different backgrounds, but they all have a shared goal of improving the way that healthcare is delivered and solving problems in the healthcare system. So right now there are currently 52 students in the MHCI. They're split among two cohorts. The most recent cohort that just started this past August has 34 students in it. They have an average of 14 years of professional experience, but there is a wide range there. At the lowest end, the program requires applicants to have at least 3 years of professional experience. And we have a few students who have been in their careers a long time and have over 30 years of experience. And they come from all over the US, and we have students from abroad as well. Right now we have students from Japan, the United Arab Emirates, and Thailand. And again, they come from many different healthcare sectors. We've listed here some of the roles and some of the healthcare settings that our students come from. But this is not an exhaustive list of the types of healthcare professionals that could be a good fit for this degree. Off the top of my head, somebody from dental medicine also could definitely get a lot out of it and contribute a lot. So even though our students are very professionally diverse, they have a lot of different goals and reasons for why they're doing this degree, but they tend to fall into three main buckets of why they decided to pursue an MHCI. So one they want to improve the work that they're doing in a current role. A second set of students have recently taken on a new role, often a more leadership role, and they want to fill in some skill gaps and knowledge gaps to be more successful in that role. Or three, they're looking to move on to a more leadership role in the future. Any questions about students or the kinds of professionals that might join the program? Okay, great. We'll move it along. The first thing that students do every school year in late August, there is the on-campus seminar. This year, it's scheduled for August 21st through 25th. Right now, late August is really hard to predict. So if we need to move it online, we're fully prepared to do that. Our team's skill set is creating meaningful experiences through online activities. So if that's something we need to do, we're totally ready for that. But either way, whether it's in person or online, there will be orientation sessions for new students, um, educational sessions. So faculty members and outside speakers will present interactive workshops and lectures. And finally, the main goal of the seminar is networking for students to interact and connect and get to know each other. So there will be a lot of networking activities. Whether it's in person or online, the seminar is no additional cost to students on top of their tuition. The only thing students would be responsible for if it's in person is for their travel to and from Philadelphia.
Catherine, somebody asks, is there an
Sure.
online only option for those of us who may not be able to travel?
So typically in the past, when the seminar has been in person, it is required for students to attend, but if there is an extenuating circumstance that'll prevent you from attending in person, I've had students work with me individually and we find a way for them to make it up. Like I said, late August at this point is a little bit hard to predict, and we might have additional online activities for the seminar, but we'll let you know about that.
Somebody else asks, what are some examples of career growth from the program? And do participants usually switch roles? And do you have workshops with Roy Rosen?
Sure. So the examples of career growth is a question that we get a lot. The program is relatively new. It's in its third year, and so far we've had one graduating class that just graduated this past May. So I don't have a ton of data on that yet, but I can give you a few examples from that graduating class. We have had some students make career changes and move to some leadership roles. For example, we've had somebody who's moved into an executive role at a digital health startup. We've had a family physician who directly through the program got a role as director of transformation in her practice group. So there definitely has been career growth among students, but again, our students are so diverse professionally that that career path is going to look super different for every individual student. And we do, Roy Rosen actually is one of our faculty members. He teaches a course in the program, and we certainly have presentations and workshops by people of that caliber as well.
One more question for
Sure.
now. Given the time difference, would living in Europe, for example in Switzerland, be compatible with the program?
Yeah, I don't think that would be a problem at all. Like I mentioned before, we do have current students now who are abroad. The only thing that happens at a specific scheduled time is sometimes there are 1 hour live sync classes. But those are also recorded, so students who can't make those classes, whether it's because of a time difference or whether it's just their schedule, can still watch the recording. And everything else in the courses besides that is available on demand. So I don't see that time difference being a problem. So what you see here is a bird's eye view of the curriculum. It can be finished in 20 months. There is also a 3-year option for anybody who might need to spread out the time commitment or the financial commitment over a longer period of time. But either way, whether you're doing the degree in 20 months or in 3 years, you'd be taking the same exact classes and fulfilling the same exact degree requirements. So like I mentioned before, the first thing that happens every school year is students attend the seminar. That always happens in late August. And then after that, for the rest of the school year, students are taking their courses online. These are condensed intensive courses. They're typically 6 weeks long or 4 weeks long for labs. And students are just taking classes one at a time. In each of these 6-week courses, while a student is in one, they usually spend about 13 to 15 hours per week working on the course. Usually there's a 1-week break between courses on the 20-month track. If you're on the 3-year track, there often are longer breaks in between courses since it's more spread out. In a little bit, Adam and I will go into more detail about the kinds of content and activities you'd actually be doing in a course. But for now, you can see that the courses listed here. And again, they cover those 4 main topic areas of health policy, operations management, behavioral economics, and innovation methodologies. In lab courses, students are able to get a deeper understanding of the concepts that they learn by practicing concepts from core courses. So for example, in the behavioral economics lab, students would get a case study to analyze, and then they'll propose an intervention, a behavioral economics intervention. So they're project-based courses. And in the final 2 labs of the program, students will actually be developing a proposal for an innovation project that they can actually then implement, would be ready to implement as soon as they're done with the degree. Students will be able to take 2 elective courses while they're in the degree, and for those electives, they'll have a few different topics to choose from. These are examples of the elective topics from this year to give you an idea of the kinds of topics that might be available. Elective topics offerings might change from year to year, but you can see here that there's a lot of different topics that students can choose from according to their own interests or professional goals. I see one question about the labs. Are the labs group-based or individual? It's mostly individual work, but often students will be asked to provide feedback on another student's work.
Hey, Catherine, before we go on, I think that dovetails really nicely with another question. Somebody asks, are there focus areas on specific sectors of healthcare, like payers or pharmaceuticals or hospitals? And to answer that question, the courses are grouped more thematically than by sector, but you will see content on all of those areas.
Great. Thanks, Adam. So I'm really glad to welcome 2 of our current students to the call to give you a little bit of an idea of what it's like from the student side. Martina is a standardized patient specialist here at the University of Pennsylvania. She's a new student who's just started this past August. And Michael is a clinical delivery, works in clinical education at GE Healthcare, and Michael is in his 2nd year of the program and will be graduating pretty soon this spring. So thanks, Martina and Michael. If you should be able to unmute yourselves and share your video now. If you both could just introduce yourselves really briefly. Martina, would you mind starting?
No, not at all. Thanks for having me. My name is Martina Plog. I'm a standardized patient educator. My elevator pitch for what that means, most people who've been in a school of medicine in some capacity have encountered a standardized patient. I'm one of the people that trains professional actors to portray patients so that doctors or any kind of learner can practice their interpersonal skills. So sometimes people refer to them as fake patients.
Thanks, Martina. Michael, can you introduce yourself?
Sure. Hi, everybody. Can everybody hear me okay, by the way? Okay, great.
Yeah.
I'm Michael Ergel. I am a registered nurse. I used to create and train development training programs for our products for GE Healthcare, but now I got promoted to a clinical delivery leader at few weeks ago. So yeah, that's what I do.
Congratulations. My first question is for both of you, and Martina, maybe you can start. Why did you decide to pursue an MHCI?
I decided to pursue this particular program because I actually was taking some law classes because I'm very much interested in policy. And as I was learning more about law and seeing how different mental models work, I was really drawn to, I started doing a little bit more research about things, programs that I could do while I'm also working full time that would start lending me into this direction. And then when I saw that this is the only program that I found that let me pull from sort of 4 different schools in a sense, and all things that interested me in a way, because I was not interested in practicing law, but I was interested in policy and how do I start implementing things, and this just rang true to me.
Thanks. So Michael, can you share why you decided to do the MHCI?
Yeah, for a long time, I was trying to figure out what my path was and got really lost for a couple of years. Ended up applying to a Master's of Public Health program. That was one of the questions, is trying to find the difference between an MA and PH. And really, I was looking for the breadth of programs variation. So, you know, as Catherine brought up, that it really comes from 4 different thoughts. So policy, operations, transformation, behavioral economics. That was one of the things that attracted me to the program. And I had already taken some ad hoc classes like Martina had before, not in law, more in operations, but that was really one of the things that really interested me into applying for the program.
Thanks, Michael. One of the questions that came in from people's registrations forms, one of the most popular questions was, I'm working full time, how do I do this program at the same time? So can you talk a little bit, Michael, maybe about how you balance working full time and taking this program?
So I travel all over the country, which is really difficult sometimes. So I'm on a plane on Monday, coming home on a Friday. And for me, during that week, I consider myself an incremental learner where I learn short bursts of things. And the way that this program is set up, the modules, and you know, how pretty much how everything is structured throughout this program, you can do it while you're traveling, while you're having a full-time gig and having a family. It is doable. And the nice thing about this program as well is its leniency. So if you need an extension for something, the TAs and the professors are more than willing to work with you depending on your schedule.
Thanks. Martina, anything you'd want to add to that?
Yeah, I came to the program after 25 years of not being in school. So I was really worried about the workload of having just taken on a fairly new job or a new position in a program that I was part of in a long time. Anyway, I would second a lot of the things that have been said already. And it took me about 2 weeks to discover that things were a lot more flexible than I had anticipated. And even though certain things are due at certain times, it's really easy to sort of make a change. And oops, are you still there?
Yeah.
I don't, so this is how I deal with it to answer the question. But I put it on their schedule. Nice. I can schedule it. I can schedule around it. And I found what's interesting is that the material is so engaging that yes, I can get the assignments done and I get them in. And to be honest, then I go back in and rework the assignments a little bit more so they become the project I want them to be. And I don't know how to express that really, because like you can get the project done, the assignments done, and then I found that they're so engaging that I take them a little bit further, not further necessarily, but tweak them to become mine. And it is manageable, much more manageable than I first thought. I sort of just had to relax. And the first time I asked for an extension, like I said, I still had the mindset of 25 years ago, and the TAs were incredible. They actually gave me more time than I even had asked for.
Great. So you talked about tweaking assignments to fit your work and what you need to do. Do you have any examples of how the program has impacted your work?
The very first class I took, I started writing about the Indian health system it wasn't even something that was on my radar. It was one of the topics that was given by Zeke, for example. And I really dove into it and became very interesting. And then it started intersecting with, I'm a co-chair of a social justice special interest group that's part of a professional organization I belong to, of standardized patient educators. And it just became really apparent how many people in Canada were doing similar work. And the annotated bibliography that was part of that project turned into something that we're now using in the organization that we're actually all building on. And
That's great.
everybody became, in an organization that didn't even know what I was doing, became very excited about this annotated bibliography that people are still adding to. I probably should tell Zeke what's happening.
Yeah, that's awesome. I didn't know about that. Michael, do you have any examples about how the program's impacted your work?
Yeah. So in our behavioral economics lab, which I took forever ago, one of the things that we did was doing a KPI tree, or a key performance indicator. I was able to translate that into my work, because one of the problems that we had was, because of the travel, we had a lot of high travel and lodging costs, and we're really trying to consolidate that. And so one of the things that I worked with our general manager and our business operations manager was this whole concept of regionalization, which, you know, from hindsight, it totally makes sense, right? Why would you, if somebody lives in Philly, why would you have them fly all the way to California? And so that's one of the things that we're actually working on now, and I was able to learn some of the concepts during this program.
That's great. So just one last question for the both of you, and then we'll have time for maybe 2 or 3 from attendees. So I mentioned this program, one of the most important aspects of it is the cohort experience. So can you tell us a little bit, Michael, about the network that you've built?
Yeah, so it's nice that I've been able to see a lot of my colleagues from my travels. So I was able to go to Miami, for example, and visit one of my cohort, and she is CEO of this kind of like this biotech startup. And because I come from a biotech background, a lot of the ideas we were bouncing off of each other kind of gained some momentum for me to try to incorporate some of the principles that she did with trying to start up her own company. And then I do travel to Philly often, so touching base with some of the fellow students that that are in my program is great. And the one we also communicate through Slack, which is nice as well.
Yeah. Martina, I know you just started this year, so haven't been in the program quite as long, but what kind of network building have you done with your cohort?
Actually, I think the seminar was really helpful. I was surprised. I like to talk a lot, but I'm still not the first one to walk up to somebody to say hi and introduce myself. Everybody there was very welcoming and interested. And so even before I left the seminar, I feel like a small network had already established. And then turned out that, I guess it's Michael's cohort started forming a society and reached out to the rest of the cohorts. So some of us started joining in that. So now there's a society that's being built, and we are working on a website and reaching out, and it's still, so that's very exciting. And I was calling it perpendicular to the program essentially, but it's paving the road for what comes next for us. Mm-hmm. And then we also have very informal things like a book club, where somebody proposes to read a book and we read the book, and then we try to find a time to discuss it. And for those of us who are local, it hasn't happened yet, but the talks are and just getting together for dinner. And then, yes, it's amazing how quickly WhatsApp, and there's a Blue Jeans lounge that the program has set up for us that is much more informal, and that became very helpful for the first lab, I must say, when all our brains sort of exploded when we had to deal with economics and equations. So we all took refuge in there. And yes, also the peer reviews have helped me tremendously, in the sense that I'm not a physician, I'm not a practitioner, and this mental model that I talk about, it comes up again when now when I pitch to faculty, I feel like I can speak their language quicker because of the peer reviews that I've gotten of my papers. So it was just simply reframing things. My background is in architecture and design, so I was always coming to everything with 3 schematics, and I realized that's not how physicians were approaching any problem. And now I walk in and I get stuff done. It's very satisfying.
Great. All right. Well, Martina and Michael, thank you. They're going to stick around on the call if any attendees have questions for them later. I'll have time to answer a few questions right now before we move on. Somebody asked, in addition to the annual August session, are there any other opportunities for people to interact in person? So no, the annual August session, that 4 to 5 days, that's the only in-person session in the program, and the rest is all online. Does this program conflict with the Wharton Executive MBA? Can they be done together? So right now, the MHCI, excuse me, cannot be done as a dual degree, and it needs to be done on its own. Any other questions for Martina or Michael before we move back to the presentation?
This could be for them, but it's also for you. Can you provide some examples of the kinds of innovation projects that students are working on?
Yeah, so our second year students just did their pitching innovation lab, in which they start putting together their project proposals. So usually they combine aspects of behavior and technology and operations. So I have a list of some of those project examples. One student is using behavioral science and messaging to increase carrier screening testing. Another is looking to optimize surgeon engagement. So for example, doing surgeon satisfaction surveys and stakeholder interviews about ideas for medical devices in their health system. A lot of them have to do with engaging either providers or patients or stakeholders in a more meaningful way. And other students working on improving quantity of customer satisfaction surveys through user experience design. I think that was actually Michael's project. But there's a lot of different projects that can be done, and students often use something that they're currently working on in work, or sometimes they come up with something new that they want to get going. Okay, so we'll head back to the presentation. Let's talk a little bit about what the actual course experience is like. So all of the courses are online. They're all on a platform called Canvas, which some of you might be familiar with. Canvas is also sort of similar to Blackboard that some of you might have used before. And if you have never heard of or used Canvas before, that's totally fine too. We teach students how to use it before they're in their courses. So to access your courses, you'd log on to the Canvas website, and all of the course content will be there available in one place and available on demand. And in a minute, Adam will show us what a course actually looks like. So again, students are spending typically 13 hours per week working on a course. They're taking courses one at a time, either a 6-week-long course or a 4-week lab. And there are 3 types of activities that you'll find in a course. One is the content and media, so things like brief lecture videos, PDF articles and readings to go along with the videos. Every week there are interactive activities, so things like weekly discussion threads with other students and a weekly faculty interaction activity. Very often that faculty interaction will be a 1-hour live sync class, so a video conferencing session that the faculty member leads. And again, those sync classes are the only thing that are ever scheduled at a specific date and time. Everything else is available on demand, but those sync classes are also recorded. So if a student can't make it, they can still watch the recording afterwards, and that's not a problem. And then finally, the last type of activity are assessments. So things like quizzes and assignments to gauge your learning. And every class has a final paper or final project. So no midterm exams or final exams. It's more project-based. And again, Assignments do have specific deadlines, but all of the content in a class is available on demand while you're in the class. And you'll find there's a weekly regular rhythm to classes, so you always know what to expect. Assignments are almost always due on Sundays and Tuesdays to give students the weekend to work on it, and you'll find that certain activities tend to happen on the same day each week, so that you can get into this sort of easy rhythm. So with that, I want to hand it over to Adam, who can show us what one of the classes looks like.
Hi, Catherine, can you confirm that you can see my my screen here?
Yes, I can.
Great, thank you. So I just want to build on what Catherine said to say that all of our classes emphasize really three things. They're predictable, which means that assignments fall on basically the same days, the due dates are predictable, but also the structure of the course. Our courses, like Catherine said, are 6 weeks or 3 weeks, and they have basically similar kinds of components. The second thing about these courses is that they are supportive. There are lots of opportunities to get help from your peers, from the MHCI staff, and from course TAs, as well as opportunities to ask questions about content from the faculty. As you can see here, this is the American Healthcare System course. It's the first course in the master's program. And there is contact information for getting in touch with TAs, there's contact information for getting in touch with us, and there's contact information for getting in touch with the faculty member. And then the third thing is that these courses are social. The main components of most courses are interactive. They come in the form of synchronous classes, as Catherine said, and they come in the form of discussions. And I'm going to show you that in just a minute. But first, I want to show you the front page of one of these courses. It's all laid out so that you can take notes and so that you can note when due dates are and have your work done on those dates. So scrolling down the page here, what you can see is that every course has an overview and learning objectives. Those learning objectives are to help you gauge what you're supposed to get out of the class and to help you assess whether you've gotten that out of the class at the end of the course. Every class has I'm sorry to scroll down the page so fast here. Every class has a list of topics and key dates that are going to get covered. They're stretched out by week, and they are set up so that you know what is due and when at every step of the way. And then the last thing that I want to show you on the front page is that every class has a clear indication of how it's going to be graded. All of our work is graded with rubrics. You'll receive comments and feedback, but there's also always a rubric so you know why you did the way that you did on an assignment. Finally, scrolling down to the bottom, what you'll see is this big red Start Here button, which is really the gateway to the content of the course. I'm not going to click it. I'm just going to take you to the next tab here. And this is where that Start Here button will take you. It's the course modules page. And the course modules page is really the heart of the content of the course. I'm just going to show you one module. This is week 1 of the American Healthcare System. Every module has videos that you can watch. You can see them here. They have times noted so that you know, like if you're on your way out the door, you can watch one more, or maybe you can't. Every module has readings. There's 2 readings for this week. One is some chapters in a book, and the other is an article in the New England Journal of Medicine. And then finally, every weekly module has some work. So these are the interactive components, the synchronous class and the discussion, and the build your knowledge assignment, which is a practice assignment that asks you to reinforce some of what you've learned by doing a sort of simple but representative task. This is what our video pages look like. All of our courses, almost all of our courses, have video lectures. In this course, there's about 40 of them, and they're somewhere between 6 and 10 minutes long. Our video pages have clearly the lecture as the front and center, but that's not the only thing on these pages. Every page has a downloadable transcript that you can save and use for your reference. Most pages have supplemental resources that include downloadable handouts and also links to more information out there in scholarly articles or sometimes on the web. And finally, and I want to emphasize this, every page has support links. That includes information on Canvas, help with Canvas, and it also includes a link to our technical help email so that you can get answers to questions as you need them. And turnaround on answers to questions, both with the technical help email and with TAs, is usually 1 business day. Finally, the last thing that I wanted to show you is discussions. So this is a typical discussion in a class. This is the week 2 discussion from the American healthcare system. And I want you to note a couple of things. One is that there's a lot of help to say prime the pump, to get you ready to think about what you want to write. So it doesn't just leave you high and dry, asking you to sort of reiterate or build on something in the lectures without a lot of scaffolding. There's a lot of scaffolding there. The second thing that I want you to note is that when our courses get large, we often have breakout groups so that you have an opportunity to have an intimate discussion with your peers and really get to know them. And then the third thing that I wanted to show you here is that all of our discussions have some additional prompts to help you think about how to reply to your peers. And that's really important. Really, what we're getting at is you are learning from the faculty and from the course team, but you're also learning from each other. All of the people in our courses are professionals. They have a lot of experience. They have a lot of experience to share. And as you learned with Martina and with Michael, you're going to learn a lot from those folks as well. So that is our courses in a nutshell. And with that, I'm going to give it back to Catherine.
All right, thanks, Adam. So one thing I want to make clear about the courses, which Michael and Martina talked about a little bit too, is that there's flexibility built in. I mean, these courses are designed for full-time working professionals who are learning remotely. And there's a lot of help from humans. Even though you're learning remotely, you're not alone. There's a technology orientation at seminars. So before you even go into a class, we'll teach you how to access them and how to navigate them and submit assignments. We have plenty of students who've been out of school for many years, and we know how to get them on board. There are tips and tutorials, video tutorials on our student community site. You can get help with course content and deadline extensions from our TAs. There's administrative support from myself and our other staff, and we also have in-house technical support. So you're definitely well supported for learning online here. Any questions about the online course experience? I wanted to get back to one question from earlier. Are there formal opportunities for networking with innovative companies in healthcare and with hospital system leadership? Yes. So one thing we do in the seminar is a networking reception where we invite representatives from different healthcare employers and healthcare organizations who are innovative. And we also have guest speakers who come into courses and who give one-off lectures for students who are leaders in different innovative organizations and from our own health system. So students do get a chance to interact with those types of people for sure. So at Penn, students pay tuition on a per course unit or per CU basis. And a CU is simply how Penn counts course credits. One core course in the MHCI is 1 CU. So that would be equivalent to, say, a typical semester-long course, what another university might call 3 or 4 credit course. That would be 1 CU here. At next year's rate, so in the academic year 2020 to 2021, 1 CU will be $5,709, and rates are subject to change year to year. So students take 11 CUs total throughout the degree, and that puts the total cost of the degree somewhere in the ballpark of $63,000. Our students fund their tuition in a few different ways. Some are self-funded, some are able to get tuition assistance from their employers, and some choose to pursue financial aid through federal loans. There are no scholarships available from the program itself. And I do want to point out very quickly for anybody who might be considering the federal loan route, you need to take a minimum of 2 CUs in a semester to be eligible. So I have in this table on the right a breakdown of the CUs per semester on the 20-month track. You'll see that in every semester on the 20-month track, students are taking at least 2 CUs, so they'll be eligible for financial federal aid in all of those semesters. On the 3-year track, since it's more spread out, often students are taking fewer than 2 CUs in a semester, so on that 3-year track, they might not always be eligible for federal loans in every semester. One question that came in, what career and job support do you offer? So there's support from the university at a central level and then some support from the MHCI. From the university at a central level, there's a lot of self-directed career support. So the Career Services Office offers students free access to some platforms, for example, Handshake, which is a very powerful recruiting and job search network. And they offer online courses and different job searching skills like interviewing, networking, how to pitch yourself. From the program, what we do is we try to expose students and give them opportunities to connect with healthcare leaders from lots of different organizations, whether it's through the seminar, like I mentioned, through guest speakers, through one-off webinars, webinar series that we do for students. There's no formal mentoring or job placement services through the program. So what we do really is help students figure out how to pursue the path that's right for them. Is there tuition support from the Penn Medicine health system for employees of the health system? Yes, UPHS employees are eligible for tuition benefits. If you have questions about those, I'm happy to answer it outside of the session. The exact amount often depends on the individual employee's employment status and a few other factors. Is it possible to take a single class without being accepted into the degree program? I'm glad you asked that. Yes, there is an option to take one course, one MHCI course, to try it out without being fully matriculated into the program. It would be the same tuition rate that you see here, that $5,709. And if that's something that you're interested in testing out, please contact me outside of the session and we'll talk about how to make that happen. That's a good segue into this. I do want to mention before we wrap up that the department offers a couple of certificate options that have courses in healthcare innovation topics. So if you think that maybe a full master's degree isn't the right choice for you, there's a professional development certificate, which includes non-credit courses, so they are not transferable into the MHCI. And then there is an academic credit certificate with credit-bearing courses that are transferable into the master's program. So if you're interested in learning more about the certificates, you can read more on our website, improvinghealthcare.net, or feel free to contact me outside of the session and I can answer questions that you have about the certificates. So finally, if after hearing all of this, you think that the MHCI is a good fit for you, obviously the next step is to apply. The final application deadline for this year is May 1st, and that's to start the program in August of 2020. As you're working on your application, if you have any concerns about meeting that May 1st deadline due to COVID-19 related delays, so for example, if you can't get in touch with your letter writers because they're working on the front lines, or maybe your previous institution is having delays getting transcripts out, please let me know and we can work with you. To be eligible to apply, you need to have a bachelor's degree. The bachelor's degree does not have to be in a healthcare related topic. And you need at least 3 years of professional experience either in healthcare or in a related field. So if your professional experience is in a related field and not directly in healthcare, I encourage you to make a strong case in your personal statement on the application about how you will make an impact in the healthcare and how you'll use the degree. So to apply, you'll need to fill out an online application form that's available on our website, improvinghealthcare.net. You can navigate to the Master of Healthcare Innovation and then the admissions page, and you'll see a link for the form there. In the online application form, you'll be asked to upload a personal statement, a current CV or resume, and you'll be asked for contact information for recommenders who can write a recommendation letter for you. Just a heads up, when you put your recommender's contact information in the form, the system will automatically email them asking them to upload their letter. So you should give them a heads up ahead of time so they know what that email is and can expect it. And finally, the last piece of the application, the only piece that is sent outside of the online application form, are official transcripts from your previous schools. So a good general rule of thumb is we'll want to see a transcript from a school that you've gotten a degree from, or if you've done a substantial amount of coursework towards a degree at that school, we'd like to see it. Any questions about the admissions process? When attendee asks, may I ask the age range of students, as well as the average age of students in the program? I don't know the age range off the top of my head. I can tell you on average they have 14 years of professional experience, but there's a pretty wide range there. We have some students who are earlier in their career. They would have to have a minimum of 3 years of experience, and we do have students who have 25, 30 plus years of experience in healthcare as well. Is there a GPA requirement? To apply to the program, no, there's no GPA requirement. We don't require any standardized test scores, and there's no application fee. Once students are in the program, there is a minimum 3.0 GPA that students need to maintain. How competitive is admissions? I believe the last program cohort was very small. The most recent cohort that started this past fall is 34 students. It's hard to predict. I expect this year we'd be looking at a similar size cohort, maybe a little bit larger. But the goal for this program is to stay a little bit on the smaller side and high touch so that there's a lot of personal interaction in the program. So it'll never be at the point where there's, say, 100 plus students in a course the way there might be in a large in-person lecture. So that concludes the presentation. We can use the rest of the time to answer your questions. Once again, the application deadline is May 1st. When you go to fill out the online application, you'll see a screen that asks you to sign in. If you've used the application portal before, you can sign in using the same username and password you set up last time. If you have not used it before, you'll need to click on sign up and create an account in order to create your application. And again, all of that can be found on our website, improvinghealthcare.net. And if you have other questions that we don't get to, feel free to email me. My email address is mehponline@pennmedicine.upenn.edu. I'm reading that aloud for those of you who are on the phone right now. And I'll also put it into the chat box for those of you who are accessing it on a computer. But this is your time now. I'm happy to answer your questions. Oh, Adam posted my email address. Thanks, Adam. One common question that we get is what's the difference between an MHCI and, say, an MBA or an MHA? And again, the MHCI has a sort of unique curriculum that focuses on leadership and innovation skills. And other degrees are going to focus on different skill sets and not quite that same combination. An MBA definitely is going to be more management focused. It's going to be a little bit broader and not as specifically focused on healthcare. Probably will include more financial related courses, which is not a main focus of this degree, although there is one health economics course. An MHA is going to be a lot more focused on administration. So of the student body in an MHA, everyone either will be in or going into administration, whereas in the MHCI, you'll see a much wider variety of professional backgrounds. Do graduates usually use this degree and enhance their current positions, or do they change jobs or fields? It's pretty split. I had mentioned before, students tend to fall into 3 buckets with a pretty even split. In one bucket are students who are doing the degree to improve the work that they do in their current role. Another bucket is students who specifically want to take on a more leadership role in the future. And finally, we have students who come to the degree because they've just been offered a new leadership role and they want to make sure that they do well in that role. What is the ratio of staff to students? We have a staff of 1, 2, 3, 4, about 8 of us. And like I said, we have 52 current students in the program, and that's just administrative staff. That doesn't count the faculty as well. Typically, we'll see around 30 students in a course that's staffed by a faculty member, several TAs, and a course coordinator. So there are a lot of staff around to support the students. Can any of the credits be applied towards an MBA? That would depend on the particular MBA program. It's really up to that program of whether they are going to accept credits from an MHCI. Are there any scholarships available? No, there are no scholarships available from the program or from the department. I would encourage you, if you're a member of any professional organizations, checking with them. Sometimes they offer tuition assistance for members. And you can also do a search for healthcare graduate program scholarships. Often you might be able to find third-party organizations who offer scholarships. So I have a question about those going on to startups. I'm sorry, the original question is kind of far back in the chat now, but we do have several students who are who work in healthcare startups, so it certainly would be applicable to those fields. How much of the innovation aspect of this program covers technology, wearables, medical devices, AI, machine learning, et cetera? So innovation in this program is typically more focused on methodology. So things like if you have an idea for an innovative project or program, how do you pilot it? How do you operationalize it? How do you evaluate it to make sure that it's working? How do you identify areas that are in need of innovation? That being said, those topics definitely are talked about in classes. There is an elective course called Connected Healthcare that talks about connected strategies that businesses use to connect with their clients and how that gets applied in healthcare, including wearables. But technology is not the main focus of innovation in this program.
Catherine, if I can just add on to that
Yeah.
a minute. The way that innovation is positioned in this program is really grounded in design thinking, in organizational transformation, and in quality improvement. And all of those are skill sets that can be used with technology and that a lot of our students do end up using with technology, but technology itself isn't the focus here.
Yeah, thanks, Adam. You explained that a lot better than I could. Just to clarify, letters of recommendation are uploaded directly by references. Yes, that's correct. So what you'll do is in the application form, you'll type in your references, names and contact information, including their email address. And then the application system will automatically email your recommenders a link where they can upload their letters themselves. How many nationalities are represented in the program? Right now we have international students from Thailand, the United Arab Emirates, and Japan, and the majority of students are from the US. All right, so it's 5 o'clock. I want to thank you all for taking the time out today to learn more about the MHCI, and thank you especially to Michael and Martina for joining us and talking about their experience. If you have a question or asked a question that we weren't able to get to, please do email me. I'll get back to you and we'll answer those questions. And we'll be sending out a recording of the session later this week, along with that document that goes into the learning objectives and competencies in more detail. So thank you again, everyone. Have a good night and stay safe.